Well, Tanya, I think you have a fairly uncomplicated respiratory infection. I don't see anything that would indicate a need for antibiotics. What I would suggest, I'll give you the name of a cough suppressant that you can buy over the counter, and I think it should run its course within the next few days.
Okay.
Good. I also noticed you filled out one of our questionnaires. Could I look over your questionnaire and give you a little feedback?
Yes,
Would that be all right? Okay, and just to clarify from my information, on average, how many days a week would you have a drink that contains alcohol?
I don't drink very often. If I go out to dinner with my friends, I may have 1 or 2 glasses of wine.
Okay. And about how often would that be?
Like every other month, I guess, maybe. We'll go out to dinner.
Okay, and only 1 or 2 drinks when you have a drink?
Yes.
Okay. In the past 3 months, I noticed you filled out our drug use questionnaire. Can you tell me what drugs you've used, any street drugs or any prescription drugs in a way that was not prescribed?
Prescription drugs, I only use those as they're prescribed, but I have used marijuana, or I do use marijuana occasionally.
Okay. And about how often would you use marijuana?
Like maybe 2 or 3 times a month.
And on a typical day that you smoke marijuana, about how much would you smoke? How many joints?
Well, I'm usually with friends, and it's like they'll roll a blunt and we'll pass it around a couple of times. I guess I may have anywhere from 7 to 8 puffs, I guess, maybe. Just, it depends on how many of us there are when it goes around.
Okay. All right. Well, your score on this questionnaire is 3 out of a possible 10 points. Would you like to know a little bit more about what your score means?
Yes, please.
Well, we have a little diagram that we use to represent people's risk levels. There are people with no use that would have no risk, and others that are smoking perhaps on a very frequent or even daily level that would be in the high-risk group. But your use puts you in this middle zone, which indicates that you do have some risk related to your marijuana use. What are your thoughts about that?
Like at risk for what?
Well, marijuana is a drug that affects learning and memory and coordination. And so on the days that you do smoke marijuana, you're more likely to have an accident, a fall, or if you're driving, maybe an auto accident. There's some other health effects. So some of the ones that I worry the most about, anxiety and depression, and especially paranoid ideations and schizophrenia. You ever had any problems when you were out smoking marijuana with friends?
Well, yeah, recently, the last time that we were smoking, I did experience some paranoia, and that wasn't a good feeling at all. That really scared me.
Okay, so that's pretty frightening.
Very, yeah.
Well, can you give me a little more idea of some of the good things, some of the reasons that you do smoke marijuana and you like to do that?
Well, just it kind of helps you to relax, kind of mellow out. It's not something that I plan to do. It's just if my friends are smoking and I'm around, then I will, join in. It's just, that social thing is, I really didn't see it as a big deal.
Yeah, so it's a social thing. It's something that you do to sort of be a part of the group and helps you relax a little. Any not so good things? You mentioned one thing that's disturbed you already.
Yeah, well, whenever I smoke, I'm always concerned about my job, testing for drugs, because they do random drug tests, and I really can't afford to lose my job. And the paranoia was really scary for me. That last time, that was the first time I had ever experienced that, and it was just real crazy. Real crazy.
So on the one hand, you have this opportunity to relax a little bit and just enjoy spending time with your friends. On the other hand, you've got some things that have made you concerned. The paranoia really scared you, and you're also really concerned about the possibility that you get drug tested that might endanger your job. So where does that leave you in terms of continuing to smoke about like you are now, or maybe quitting or reducing what you're doing?
Well, after I had that experience with the paranoia, that really scared me, and So it was something that, I was like, I really, don't want to do this. I don't want to have this feeling anymore. So I think it may be better if I just leave it alone.
Yeah, it might be time to quit.
Yeah.
As your physician, I would say that's a great decision because none of these bad things would happen to you, at least as a consequence of your drug use, if you quit and quit completely. So I think that's a great choice. What would you say if you go out with your friends? Sounds like you do that on a regular basis. Next time you go out, you say no. How are you going to say no?
I really haven't thought about it. That's something I'm going to have to really think about how to deal with that when it happens.
Yeah. So put a little thought into that. And some people talk about their health or problems that they've had, or some people just say, I made a decision. I don't want to do that anymore.
Yeah.
You can kind of think through those and come up with something that you think would work for you and your situation and the people that you go out with.
Yeah. I think they'll understand, though, because being paranoid, and just them seeing me that way, I think they'll understand if I say no.
So some of them were actually a part of that experience.
Yeah.
So that may help them understand. Well, I think that's a great decision, Tanya. As I said, I want to give you today some information. I'll write out the name of that cough suppressant for you.
Okay.
And I'll see you for your next annual visit when that comes due, or you know how to find us before then if you need us.
Okay.
All right.
Okay.
Good. Well, thanks for talking with me about this today. I know these are not the easiest things to talk
Yeah.
about, but I think you've demonstrated some really clear thinking, and let me know if there's any way I can help.
Okay. Thank you.
You're welcome.